What we are seeing currently is mucormycosis in maximum number of patients. Maximum people have uncontrolled diabetes. This is the one of the most important risk factors. Apart from that, those patients who have lung disorders in so many days, months, those who have liver disorders, kidney disorders since so many years, they are a high risk category people for mucormycosis. But the most important is uncontrolled diabetes. So if you want to reduce the risk of mucormycosis, one of the most important thing is to control your sugar as better as possible. So as better as possible means the fasting blood sugar has to be around 100. It should not be like 150, 200 and 250 and 300. It has to be less than 100. The fasting sugar has to be at least around 70 to 100, but at least around 100. And the sugar after 2 hours after taking food, that is called postprandial blood sugar, should be around 140, or ideally it should be less than 140, but at least it has to be around 140. And the HbA1c, that is the 3 months blood sugar average, has to be around at least 6.4. It should not be like 8 and 9 and 10 and 11 and 12 and 13, 14, because so many patients, maximum number of patients who have mucormycosis usually have HbA1c of more than usually 8, 9, 10, around 15, 16 also. So the most critical thing to prevent or to reduce the risk of mucormycosis is to control your sugars to as best as possible. If you don't know whether you have sugar or not, you can simply do a fasting blood sugar, a postprandial blood sugar, and HbA1c, which will simply tell you whether you are diabetic or not. If you are newly diagnosed diabetes, you can start the treatment of sugar to minimize the fluctuations in the sugar and to maximize the sugar control so that the risk of mucormycosis can be significantly reduced. Thank you.